Good day, everyone. My name is Uzamaka Rebecca Ivokwe. I'm a student of Ines Ruhengeri, Level 3 Biomedical Laboratory Science. I'll be presenting on applied immunology. And basically, I'll be presenting on the following topics: serotherapy and how it works, the risks of serotherapy, how adjuvants improve immune interaction with vaccine, the role of cells in vaccine efficacy. Serotherapy is a medical treatment that involves the use of antiserum. Antiserum is a blood-derived fluid containing antibodies. And also, the roles of serotherapy. These antibodies have been exposed to a specific pathogen such as virus, bacteria, toxins, and have developed anti-immunity to it. So, we'll talk about how serotherapy works. In number one, the collection of antibodies. This process begins by collecting the serum from an animal or a person who have been immunized or recovered from an infection. That's to say, you take a serum from someone who have been immunized or have been exposed to a certain disease and have developed an antibody against it. And the second step on how serotherapy works is purification and processing. This means the collected serum is processed and purified to extract the antibodies. That's to say, when this serum is being taken from a person or an animal, it's being processed and purified before given to another patient. And the third step is administration. This antiserum is injected or administered intravenously to the patient, depending on the type of infection that is being treated. And we'll go to the fourth one, talking about how this serotherapy works. The fourth is passive immunity. This means the patient receives the preformed antibodies, offering immediate protection, but without the need for their immune system to regenerate its own defense. This place, you are likely explaining that the passive immunity, just like it is more like an opposite to adaptive immunity. Adaptive immunity, which we have to inject antigen to the patient, but here in this serotherapy, we are injecting antibody to the patient, so the patient does not need to develop his own antibodies. Then we'll talk about again the risk of serotherapy. So the risk of serotherapy arises due to the nature of the therapy. Number one, we have the allergic reaction. This reaction can cause symptoms such as fever, rashes, joint pains, and swelling. And the second risk of serotherapy is the delayed immune protection. As we know, serotherapy is temporary and typically lasts only a few weeks to months. Therefore, the patient may still be susceptible to the reinfection or reoccurrence of the condition after the effect of the serotherapy occurs. What we are saying here is that serotherapy doesn't last for long. So when a patient receives antibody from his donor, which we know the patient is a recipient, so when he receives this antibody from the donor, it does not last for long. It is not a permanent treatment. It is more temporary. It lasts only for a few weeks to months. And another risk factor is the transmission of diseases, where there is more a transfer of disease from the donor to the recipient, especially when there is no proper treatment to the serum taken from the donor. And again, we are going to talk about the adjuvants. Adjuvants are substances that are added to vaccines to enhance the body's immune response to the antigen. Adjuvants are more like the vaccine boosters, they help the vaccine to be active in the body. So when an adjuvant is added to a vaccine, as we said, it is a vaccine that is being added. So when an adjuvant is added to a vaccine, it makes the body to respond quickly to the vaccine. Adjuvants also help activate antigen presenting cells such as dendritic cells, macrophages, and B cells. And lastly, talking about adjuvants, they help the body produce memory cells like B cells, T cells, which are responsible for long-term immunity. And we'll go to the roles of memory cells in vaccine efficacy. The roles of memory cells are rapid and strong response to reinfection, because the memory cells enables B cells to quickly recognize the antigen and produce large amounts of antibodies to neutralize the pathogens that have been exposed into the body. Then another role of memory cell is long-term protection. Once memory cells are formed after vaccination, they can persist in the body for years or even lifetime, depending on the vaccine. Memory cells enable the immune system to mount a rapid and efficient defense when re-exposed to the particular pathogen. And again, we'll talk about the importance of memory cells. The last one is the cross protection. In some cases, memory cells can also provide cross protection against closely related strains of pathogens. Example, the immune response generated by one strain of flu virus can sometimes provide some levels of protection against other strains that share the same antigen. What we are saying here is that, for example, we take a vaccine that has to do with chicken pox. The same vaccine, if it's having the same antigen, like if that vaccine is having the same antigen as chicken pox, if that same patient that has received that vaccine is being exposed to that chicken pox again, like the patient received vaccine for chicken pox and is being later in years exposed to smallpox, that in as much as these viruses contains the same antigen, that vaccine can likely fight for it. So thank you so much. This is the end of my presentation on these topics.